watching Good Day Marketplace on Fox 28.
And we're also going to tell you what's new to enhance your lips when the dry and the heat and everything attacks them. Summer does take a toll. We'll talk lip augmentation with a professional today. Coming up next, we've got some loving for your lips. We're going to talk lip augmentation with Donaldson Plastic Surgery. They say women with fuller lips are more attractive. Don't stare at my lips right now. But I'm with Jeffrey Donaldson. He, of course, is from Donaldson Plastic Surgery. Great plastic surgeon. It's good to be with you today.
You as well. Thanks for being here.
We are actually going to talk about fillers and what is called lip augmentation. Yes. So explain for people what that really means.
Absolutely. So unfortunately, there's many examples of poor lip augmentation out there. People with these giant lips, and it just doesn't need to be that way. If you're in the right hands and you're using the right product, you can really get a natural look that's subtle. It gives you a little more perkiness, and it's fun.
And that is the problem. I think people see those earlier photos that were done wrong, and you think, oh my gosh, I'm going to look like a duck, or whatever the case. But you now say there are so many products, and it's done so differently. It's really come a long way.
It really, really has. And so fortunately, we have Sarah here, who's got really attractive features to her lips, and she's interested in having a little bit fuller look, and so she's offered to show us how it's done and be a model patient. So
is she a perfect candidate for this?
She is, again, because she's got really attractive features and lines. She's got nice fullness to each aesthetic subunit. So what we're going to do here is not reinvent the wheel, but actually just give her a little bit more of what she already has. So we've started by putting an anesthetic cream on her lips. So this should really be a very painless process. She's really not going to feel much at all, which is people's main concern.
Right. Well, and I'm always here to hold hands, just so you know. No, but right now, you're very numb, aren't you?
Yeah, a little bit.
I won't ask you to talk too much, don't worry. But for people who have never had this before, what kind of a sensation do you expect initially with this? Is it a prick? What do you think?
You know, it is a very small needle. It's about the width of one of her hairs, and so it's really not bring your head on back here, Sarah. Perfect. So she can expect that she's just going to feel a little bit of pressure, and really that's it. We're going to begin here. I like to go inside the lip, and this is Juvederm that we're using. So this is hyaluronic acid that's naturally found in the collagen of everyone's skin. So the body recognizes this as self. I'm going to go ahead and massage a little bit.
And the substance then, since you said it is natural, it lasts for how long?
This lasts anywhere from, technically it should be there for about a year, but I think because the lips are constantly in motion, we're laughing, we're chewing, we're talking.
Oh my gosh, it looks so pretty already.
It may go away a little bit faster, but yeah, you can really start to see immediately.
Hello, Angelina.
Wow. So we've just done part of the top. We'll do a little bit in the bottom just to balance, but I'm going inside the red substance of the lip and just giving her a little more plumpness. And that's really it.
Oh my gosh, it looks so natural. I'm really impressed.
We'll go around to the other side and just do a little bit more here,
Are you doing okay? You are. You know, it's just, I'm amazed. You're hardly even flinching.
One last one right here. 1, 2, 3.
And what kind of, is there bruising to be expected, or is there any kind of special treatment after the fact?
There can be bruising. Usually in about 1 in 20 patients, we see some bruising, in which case we'll use arnicare or some type of homeopathic remedy to try and decrease the swelling and bruising. If there is bruising, it's usually only there for about a day or two. Oftentimes I'll tell patients as well, the night after the procedure or the next morning, sometimes they'll wake up and their lips will be a little bit more swollen as well. Tell them not to worry, it's not product, it's just swelling.
And essentially, that's the whole procedure?
That's it. We'll probably go back and touch up just a couple spots here after she's
It's so pretty. I mean, you're going to be blown away. It really is. Yeah. And you didn't know what to expect.
I didn't.
That's great. So. Now get out of the chair. It's my turn. No, Dr. Donaldson, thank you so much. Now, Juvéderm, we know, is one product, and what would be another?
We can also use Restylane. Sometimes patients will use Bellatero. We're also using Juvederm Ultra Plus, which can last a little bit longer. So a lot of different options. There's something coming down the pike called VOLBELLA. We'll have that in our hands probably before anyone else in Columbus. That'll be in September, October.
Wow, that quickly. It's already done. And if you'd like to get the fuller lip look too, contact Dr. Donaldson at Donaldson Plastic Surgery.